How do we define depression? Based on your experience, what are the rate of depression in adolescents in Malaysia? What do you think about those who declare themselves as depressed without having a proper diagnosis?
All right, thank you very much for the 3 questions. If I forget, please do repeat the 2 questions here. Okay, so when we talk about depression, depression is one of the more common mental health disorders out there. And obviously it's the more common disorder that is afflicted amongst children, obviously. And when we talk about mental health conditions, there are many. There are hundreds clinical diagnoses of mental health disorders out there. And so what we need to really understand is anyone can be afflicted with a mental health condition. So we are all prone, we are all susceptible of the condition if all or many factors are present. So basically, how you would be afflicted with a mental health condition is multifactorial, yeah? 2, you need to have a minimum of 5 from 9 symptoms for a minimum of 2 weeks with 1 in 2 of these symptoms present. Feelings of depressed nearly the entire day for a minimum of 2 weeks, and or losing interest in the things that you like to do or in the things that you find pleasurable for a minimum of 2 weeks as well. So the other 7 symptoms could be, for example, change in your sleeping habits. That means either you sleep more or you sleep less, or there is a change in your eating habits. You eat more or you eat less. You lose interest in, as mentioned, doing things that you like. And of course, if you find it difficult to focus, you find that there is probably slowness in the way you think or in your movements. And also you have excessive guilt, which is not equivalent to what you're currently experiencing. And you also feel that you're not worth it, or you find, feelings of, you're not worth being loved, as an example, and you find yourself feelings of or easily giving up, and then you will eventually battle suicidal thoughts, or ideation, not necessarily in behavior, just in thoughts. So if you have a minimum of these 5 symptoms for a minimum of 2 weeks, then please seek professional help, because there is a chance that you might be struggling with depression. So these are basically some of the symptoms of a clinical diagnosis of depression. And we're looking, if we refer to the National Health and Morbidity Survey, we're looking at about 1 in 5 students currently are feeling depressed or have symptoms of depression. So that's actually quite a worrying number. And obviously, depression is one of the most common, mental health disorders out there. So when we talk about people that do self-diagnose, there's actually a lot of harm, because one, you might think that you have a certain condition, but maybe you don't have it. And when this happens, people that are indeed struggling with a mental health condition, you might minimize their struggles as well. So you might be reinforcing that stigma, because as we know, when we talk about mental health condition, it's really highly stigmatized, and typically I call stigma the true poison of it all, because it hinders a person from getting that help that they very much need and require. And the other thing as well is you might miss a certain medical condition that you might have, because you assume that you have something else, as an example. Or it also might be a comorbidity. That means maybe you do have depression, but you might have something else in combination as well. Because usually depression comorbids with anxiety. So 50% of people that are afflicted with depression typically have anxiety as well. And people that have anxiety disorder, 50% of the time have depression as well. And so it's very important for us to really, understand and get a proper assessment, clinical assessment, so that we can get that treatment that is accurate to what we are actually experiencing at the moment. So this is very important, because the process of recovery can only happen when we really understand what our symptoms are, and if we get a correct diagnosis, because obviously every condition is different. So this is, some of the harms of self-diagnosing, inshallah.